to 56% of Americans don't get enough magnesium. That's more than half the population running low on a mineral involved in over 300 enzymatic reactions: energy production, protein synthesis, muscle function, blood pressure regulation, and nerve transmission. Most of them have no idea, because the early signs are common enough to be dismissed as everyday stress or aging. The frustrating part is that standard blood tests miss magnesium deficiency most of the time. Only 1% of your body's magnesium is in your blood. The rest is in bone and soft tissue. So your labs can look normal while your cells are functionally depleted. In this video, we are going to see the actual symptoms of low magnesium, why deficiency is so common today, and what the research says to do about it. The research on magnesium deficiency is unambiguous in one direction: it's widespread and consequential. Studies in nutrition reviews, nutrients, and magnesium research have documented its role in cardiovascular disease, metabolic syndrome, type 2 diabetes, anxiety, and accelerated aging. This isn't a fringe nutrient, it's a foundational one that modern diets systematically fail to deliver. Research shows this pattern is more consistent across populations than previously understood. The biggest myth about magnesium deficiency is that if your blood test is normal, you're fine. This is factually incorrect. Because serum magnesium represents a tiny fraction of total body magnesium, your blood maintains normal levels by pulling from bone and muscle reserves. By the time serum magnesium drops, you're already in a significant deficit. The real indicators show up as symptoms long before blood work changes. Modern food processing has dramatically reduced dietary magnesium. Refining grains removes up to 80% of their magnesium content. Crop soil depletion over the past 50 years has reduced the magnesium content of vegetables. And high-stress lifestyles increase urinary magnesium excretion significantly. Stress literally drains your magnesium reserves faster. This triple hit is why deficiency is so prevalent despite people eating what they think is a balanced diet. The symptom picture of magnesium deficiency is wide and easy to misattribute. People dismiss these signs as stress, getting older, or just being tired. But when you look at them through the lens of magnesium's biochemical roles, ATP synthesis, calcium channel regulation, neuromuscular function, every single symptom makes mechanistic sense. These aren't random complaints. They are a recognizable pattern. A comprehensive review published in Nutrients in 2015 catalogued magnesium's roles across over 300 enzyme systems. The review found that suboptimal magnesium status is independently associated with increased risk of type 2 diabetes, hypertension, cardiovascular disease, osteoporosis, and depression. What makes this significant is the dose-response relationship. The lower your magnesium status, the higher your risk across all these conditions. Magnesium's role in sleep is particularly well documented. A randomized controlled trial found that magnesium supplementation in older adults with insomnia improved sleep efficiency by 13%, reduced nighttime waking by 74%, and increased melatonin levels measurably. The mechanism involves magnesium activating GABA receptors and regulating the melatonin synthesis pathway, two processes that directly govern sleep onset and depth. Regarding anxiety, research shows magnesium modulates the HPA axis, the stress response system. When magnesium is sufficient, NMDA glutamate receptors are partially blocked, preventing the overactivation that drives anxious thought patterns. Studies show magnesium supplementation reduces mild to moderate anxiety scores by 20 to 30% in placebo-controlled trials. The effect is strongest in people who were deficient at baseline. Research shows this pattern is more consistent across populations than previously understood. Not all magnesium supplements are equal. The form matters enormously for absorption and clinical effect. Magnesium oxide, the most common and cheapest form, has only 4% bioavailability. Magnesium glycinate and malate absorb well and are gentle on digestion. Magnesium threonate specifically crosses the blood-brain barrier and shows promise for cognitive and anxiety applications. Research shows this pattern is more consistent across populations than previously understood. The approach to correcting magnesium deficiency has three components: dietary foundation, supplement selection, and absorption optimization. Diet first, because food-based magnesium comes with cofactors that improve utilization. Supplement form second, because choosing the wrong type is effectively wasting money. And absorption third, because several common habits, including high calcium intake, alcohol, and certain medications, actively block magnesium uptake. The research-documented timeline for magnesium repletion is reassuring but requires patience. Early improvements in muscle cramping and sleep often appear within 1 to 2 weeks of adequate supplementation. Anxiety and mood benefits typically emerge by week 4. Measurable changes in blood pressure and blood sugar regulation appear by weeks 8 to 12 of sustained intake. The full replenishment of bone magnesium reserves takes longer. The daily practice for correcting magnesium deficiency is straightforward. On the food side, 1 ounce of pumpkin seeds provides 37% of your daily magnesium RDA. A cup of cooked spinach delivers 39%. On the supplement side, 300 to 400 milligrams of magnesium glycinate before bed is the most commonly effective protocol for sleep and general deficiency correction. Consistent daily intake matters more than occasional higher doses. The symptom-based approach helps you choose the right form of magnesium. If your primary complaint is sleep trouble and anxious thoughts at night, then magnesium glycinate 300 to 400 milligrams before bed is your best starting point. If you're dealing with chronic fatigue and muscle weakness, magnesium malate with meals addresses the energy pathway more directly. If brain fog and focus are your main issues, magnesium threonate is the most studied form for cognitive applications. Magnesium deficiency is one of the most common and most consequential nutritional gaps in modern health, and one of the most fixable. If you're experiencing poor sleep, muscle cramps, persistent anxiety, or fatigue that doesn't fully resolve with rest, magnesium status is worth addressing directly. The research is clear, the solutions are accessible, and the timeline for improvement is measured in weeks, not years. One of the most underrated moves you can make for your energy, sleep, and stress response is simply ensuring you're getting enough magnesium. Not an exotic supplement, just a fundamental mineral that modern life systematically depletes. The research has made the case. The implementation is simple. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups.